Everyone watching this has met or will meet a Christopher Doe in their lifetime. Christopher is a passionate baseball player, an excellent student, a loved son, an individual with goals and aspirations, like many people his age today. Baseball was his game, and when he was on the field, his presence dominated, as he was not only good at the game, but he was loved and he was supported by his friends and family members. But the day did come where he was no longer able to enjoy the game, where enjoying the game became a mechanism of escape from the harsh reality that Christopher was living in. Christopher sustained a back injury after a motor vehicle accident and was prescribed opioids to help ease his pain, which frankly is a very common occurrence. Anne-Marie, his mother, said that she noticed a change in his behavior after he started the course of medications. She says that when she looked at her son, it was as if he was no longer there. The son who was passionate, who was a great student, who was strong in the face of adversity, had weakened in many aspects of his life. Now, instead of going home and thinking about how he was going to grab that baseball mitten and head to the park, his only thoughts became how he was going to go home and grab that bottle of pills and relieve his pain. That high he felt during the game was no longer enough to sustain the psychological effects his body was facing. And eventually, 1 pill a day became 25 pills daily. When his mother sent out for help, no treatment facility accepted him due to his aggressive behavior and demeanor. At age 22, Christopher died from an opioid overdose. Now, why am I telling you this? Why is it important for you to know of Christopher? Christopher is one of the thousands of individuals who have died from opioid abuse. Now, Mark Bauer, 18, died from prescription drugs. Brenda, 25, prescribed opioids and has been in recovery ever since. See, all these people, they were looking to find a solution to a problem that they had, but instead, they were judged for how opioids affected them. Instead of being welcomed into sobriety, they were turned away and left to deal with it alone. The opioid epidemic begins and ends with how we understand opioids. Opioids are a class of medicine found in the opium poppy plant, and these medications create various effects in the brain, such as relieving severe pain. They're often prescribed by doctors as just painkillers, or they're even sold as illegal drugs in the street, such as heroin. Opioid drugs begin to bind to opioid receptors in the brain and spinal cord, and in doing so, it blocks pain signals between the brain and the body, and in return creates that relieved feeling that the users get addicted to. And it's this relieved feeling of being happy, relaxed, or high that the users tend to get addicted to. The most commonly prescribed opioids are oxycodone, methadone, hydrocodone, codeine, and morphine. According to the National Institute of Drug Abuse, there were 17,029 deaths from prescription opioids alone in 2017, from 70,237 overall opioid deaths. From 1999 to 2017, more than 702,000 people died from an overdose of drugs. Now, we can never truly understand the pain people are in physically, as pain ratings are subjective, and each individual has a different perception of pain. Today, if you walk into an emergency room because you sprained your ankle, what's the first question that they ask you? They say, what's your pain rating on a scale of 1 to 10? Now, this is a really important question when you're evaluating a patient. But the problem is that questions like these are subjective. You can have a pain level of 1, but make it seem like a 10. And a person in pain will get pain medication. So it doesn't have to be morphine, but it will be some sort of pain relief that will get those who are addicted or those who suffer from an addiction the quick fix they need, when in reality they need long-term treatment. But emergency rooms aren't made for long-term treatment. And this is why it is imperative that we increase the regulation on opioid prescriptions and for physicians to push for more alternative routes of pain relief, especially for chronic pain patients. According to the National Center for Complementary and Integrative Health, there are several alternative approaches for chronic pain that evidently suggest that they're capable of aiding with conditions of pain. These approaches include acupuncture, meditation, spinal manipulation, and even yoga. According to the American Society of Anesthesiologists, acupuncture surgery, nerve blockers, physical therapy, all of these are safer alternatives to opioids. Opioids and pain medications should always be the final solution to any pain or chronic pain type conditions after a physician has tried several alternatives. And a combination of these methods, along with over-the-counter alternatives such as acetaminophen or ibuprofen, are much safer and more effective. According to the National Safety Council, opioid painkillers are actually less effective in treating pain than ibuprofen and have far more dangerous consequences to their use. I want to emphasize something that I said in the beginning, and that's one day we will meet, or we could have met, a Christopher Doe in this lifetime. And it could be a family member, a friend, a teacher, or even just a person who sits next to you in class. He should have never been left alone to fend for himself. And it wasn't just the healthcare system and the laws that failed him, it was the negative stigma that surrounds drug users. If you use drugs, your perception in the eyes of the world changes forever. And how do we know this? Well, have you ever gone up to a cancer patient and said, "Oh, you have cancer? Well, you have lung cancer? Wow, that's terrible. Did you smoke your entire life?" It's because you smoked, right? No one ever says that. How about someone who had a heart attack? Do you tell a person who's had a heart attack, "You did this to yourself, you deserve it"? No, you don't. So why is it when it comes to drug users, when we find out that they die of an overdose or from effects of their addiction, the common reaction is, "Oh, you did that to yourself, you deserve it"? You can link an individual's smoking habits to their lung cancer diagnosis, or a person's eating habits to their history of heart attacks. Despite the many flaws in our healthcare system, when these medical emergencies happen, there's always a set treatment for them without having to face a systematic judgment. You won't be judged as harshly for having cancer, even though you smoked your entire life, ultimately causing that cancer. You won't be judged as harshly for having heart attacks, even though you made the life choice to eat McDonald's every day, which ultimately contributed to your history of heart attacks. If you make these choices, you have medical programs and can seek endless support from your family, from your friends, and your neighbors to get you through it. But if you happen to get into a car accident, injure your back, get prescribed painkillers, become addicted, then die, you are the problem. Suddenly, you become the Christopher Doe, and you deserve the outcome that your addiction has brought to you. Opioid use can lead to more problems than they were meant to treat, and this is why reducing their prescription and using and focusing on non-opioid alternatives for pain treatment would be greatly beneficial to society and patients. Thank you.